Question 1. A 45-year-old patient presents with chronic sinusitis. The physician performs a diagnostic nasal endoscopy and also performs a polypectomy from the middle meatus. What CPT code should be reported? A. 31,237, 31,231. B. 31,255, 31,237. C. 31,237. D. 31,231, 31,237 to 59. Answer, C. 31,237. This question tests understanding of CPT coding for nasal endoscopy procedures, specifically identifying bundled services. The key is recognizing that a diagnostic nasal endoscopy, 31231, is always included when a surgical nasal endoscopy, such as a polypectomy, 31237, is performed during the same encounter. Therefore, only the code for the surgical procedure, 31237, should be reported. For example, if a physician uses the scope to look around and then removes a polyp, only the polyp removal is coded because the diagnostic part is inherent to the surgical service. Always remember to choose the most comprehensive code that accurately reflects all services provided. Question 2. A patient undergoes a complete bilateral intranasal ethmoidectomy. What CPT code is appropriate for this procedure? A. 31,255. B. 31,254. C. 31,255 to 50. D. 31,254 to 50. Answer, C. 31,255 to 50. This question evaluates the proper CPT coding for bilateral surgical procedures, specifically an ethmoidectomy. A complete intranasal ethmoidectomy is reported with CPT code 31255. Since the procedure was performed bilaterally, modifier 50, bilateral procedure, must be appended to the CPT code. For example, if the physician performs the complete ethmoidectomy on both the left and right sides, 31,255 to 50 correctly represents this service. Always remember to use modifier 50 when a procedure explicitly stated as unilateral in its description is performed on both sides during the same operative session. Question 3. A 6-month-old infant is admitted for severe respiratory distress due to acute bronchiolitis. The physician orders continuous nebulized albuterol treatment. What ICD-10-CM code is most appropriate for the primary diagnosis? A. J29. B. J21, 0. C. J45, 909. D. J98, 8. Answer, B. J21, 0. This question tests the precise application of ICD-10-CM codes for respiratory conditions in infants. The keyword acute bronchiolitis in an infant, implicitly under 2 years old directs you to a specific code within the J21 series. Code J21, 0 specifically represents acute bronchiolitis due to respiratory syncytial virus, RSV, which is the most common cause in infants and the default if not otherwise specified. For example, if an infant is diagnosed with bronchiolitis, J21, 0 is often the correct code unless a different causative organism is documented. Always choose the most specific ICD-10-CM code available based on the physician's documentation, especially when age-specific codes exist. Question 4. A patient undergoes a diagnostic thoracoscopy with biopsy of the pleura. What CPT code should be reported? A. 32,607. B. 32,608. C. 32,650. D. 32,606. Answer: A. 32,607. This question assesses knowledge of CPT codes for thoracoscopy, differentiating between diagnostic and surgical procedures. The keywords diagnostic thoracoscopy and biopsy of the pleura indicate that a scope was used to visualize the pleural space and a tissue sample was taken. Code 32607 specifically describes a diagnostic thoracoscopy with biopsy. For instance, if a physician inserts a scope to look for abnormalities and takes a small piece of tissue from the lung lining, 32,607 accurately captures both elements. Always remember that when a diagnostic endoscopy includes a biopsy, there's often a single, comprehensive code for the combined service. Question 5. A 70-year-old patient presents with chronic obstructive pulmonary disease, COD, with acute exacerbation. The physician performs an initial inpatient E/M service. What ICD-10-CM code is appropriate for the primary diagnosis? A. J44-0. B. J44-1. C. J44-9. D. J43-9. Answer: B. J44-1. This question tests the precise application of ICD-10-CM codes for chronic obstructive pulmonary disease. The keywords COPD and acute exacerbation are crucial for selecting the correct code. Code J44-1 specifically represents chronic obstructive pulmonary disease with acute exacerbation. For example, if a patient with a history of COPD experiences a sudden worsening of their symptoms requiring hospitalization, J44-1 is the appropriate diagnostic code. Always be sure to capture the acuity and specific manifestations of chronic conditions when coding. Question 6. A patient undergoes a total removal of one lung. What CPT code should be reported? A. 32,440. B. 32,480. C. 32,501. D. 32,503. Answer: A. 32,440. This question tests the understanding of CPT codes for major lung resections. The keyword total removal of one lung clearly indicates a pneumonectomy. CPT code 32440 specifically describes a pneumonectomy, which is the complete removal of an entire lung. For example, if a patient has a severe lung disease or cancer requiring the removal of one whole lung, 32440 is the correct code. It's important to differentiate this from a lobectomy, which is the removal of only a lobe of the lung, or a wedge resection, which is an even smaller removal. Question 7. A patient presents for removal of a foreign body lodged in the nasal passage. The physician uses a hook and forceps to retrieve the object without general anesthesia. What CPT code is appropriate? A. 30,300. B. 30,310. C. 30,320. D. 30,999. Answer: A. 30,300. This question assesses the coding for foreign body removal from the nasal passage. The keywords foreign body lodged in the nasal passage and without general anesthesia point to a simple removal. CPT code 30300 specifically describes the removal of a foreign body from the nasal cavity, requiring neither general anesthesia nor an incision. For example, if a child has a small toy piece in their nostril that a physician can easily retrieve with instruments in the office, 30300 is the correct code. Always differentiate between simple removals and those requiring more extensive procedures or anesthesia. Question 8. A physician performs a diagnostic bronchoscopy with brushing for cytology. What CPT code should be reported? A. 31622. B. 31623. C. 31624. D. 31628. Answer B. 31623. This question tests the CPT coding for bronchoscopy with specific diagnostic interventions. The keywords diagnostic bronchoscopy and brushing for cytology directly lead to the correct code. CPT code 31623 specifically describes a bronchoscopy with brushing or protected brushing, which is used to collect cells for cytological examination. For example, if a physician uses a bronchoscope to examine the airways and then passes a small brush through the scope to collect cells for cancer screening, 31623 is the appropriate code. Remember that separate codes exist for different types of diagnostic maneuvers performed during a bronchoscopy, so specificity is key. Question 9. A patient undergoes surgical repair of a deviated nasal septum. What CPT code is appropriate for this procedure? A. 30,400. B. 30,520. C. 30,540. D. 30,600. Answer B. 30,520. This question focuses on the CPT code for septoplasty, a common nasal surgical procedure. The keywords surgical repair and deviated nasal septum clearly indicate a septoplasty. CPT code 30520 specifically represents a septoplasty, which is the repair of the nasal septum. For instance, if a patient has difficulty breathing through their nose due to a crooked septum and undergoes surgery to straighten it, 30520 is the correct code. It's important to distinguish this from other nasal surgeries like rhinoplasty or turbinate reductions. Question 10. A physician performs an anterior rhinoscopy to evaluate a patient's nasal cavity for epistaxis, nosebleed. What CPT code is appropriate? A. 99,203. B. 99,213. C. No separate CPT code for anterior rhinoscopy. D. 30,200. Answer C. No separate CPT code for anterior rhinoscopy. This question tests the understanding of coding for routine examination components versus separate procedures. An anterior rhinoscopy is a visual examination of the nasal cavity using a nasal speculum, which is a standard part of a general physical examination or an evaluation and management (E/M) service. Therefore, there is no separate CPT code to report specifically for an anterior rhinoscopy when performed as part of an E/M service. For example, if a doctor uses a speculum to look inside a patient's nose during a regular office visit, this visual inspection is considered part of the E/M service and is not separately billable. Remember that simple, routine components of an E/M service are typically bundled into the E/M code. Question 11. A 35-year-old patient presents with acute maxillary sinusitis that has not responded to initial treatment. The physician performs a puncture of the maxillary sinus with lavage, irrigation, to remove purulent material. What CPT code should be reported? A. 31,000. B. 31,020. C. 31,030. D. 31,050. Answer B. 31,020. This question assesses the CPT coding for sinus procedures involving puncture and lavage. The keywords puncture of the maxillary sinus and lavage indicate irrigation through a puncture site. CPT code 31020 specifically describes a maxillary sinusotomy by way of the inferior meatus, or other approach, with lavage. For example, if a physician inserts a needle into the maxillary sinus to flush out an infection, 31020 accurately captures this procedure. Always be sure to identify the specific sinus involved and the method of intervention when coding sinus procedures. Question 12. A patient with chronic asthma receives an initial prescription for a nebulizer machine. What type of code is used to report the nebulizer equipment for billing purposes? A. CPT code. B. ICD-10-CM code. C. HCPCS Level 2 code. D. DRG code. Answer: C. HCPCS Level 2 code. This question tests the understanding of different code sets used in medical billing, specifically for durable medical equipment. The keyword nebulizer machine refers to durable medical equipment, DME, which is typically reported using HCPCS Level 2 codes. HCPCS Level 2 codes are used to report services, supplies, and equipment not covered by CPT codes. For example, a specific HCPCS code like E0570 would be used to bill for the nebulizer machine itself. Always remember that CPT codes describe procedures and services, ICD-10-CM codes describe diagnoses, and HCPCS Level 2 codes describe supplies, equipment, and certain services. Question 13. A patient undergoes a total laryngectomy with radical neck dissection. What CPT code should be reported for the laryngectomy? A. 31360. B. 31365. C. 31367. D. 31368. Answer: B. 31365. This question evaluates the CPT coding for a complex surgical procedure involving the larynx. The keywords total laryngectomy clearly define the primary procedure. CPT code 31365 specifically describes a total laryngectomy with radical neck dissection, either unilateral or bilateral. For instance, if a patient has advanced laryngeal cancer and requires complete removal of the voice box along with lymph nodes in the neck, 31365 is the appropriate code. It's important to select the code that encompasses all integral components of the procedure performed. Question 14. A patient is diagnosed with acute pharyngitis. What ICD-10-CM code is appropriate? A. J020. B. J029. C. J0390. D. J069. Answer: B. J029. This question tests the application of ICD-10-CM codes for common upper respiratory infections. The keyword acute pharyngitis describes an inflammation of the pharynx. Code J029 specifically represents acute pharyngitis, unspecified, meaning the causative organism is not documented. For example, if a patient presents with a sore throat, and the doctor diagnoses acute pharyngitis without specifying if it's strep or viral, J029 is the correct code. Always strive for the most specific code, but use unspecified when further detail is unavailable in the documentation. Question 15. A physician performs a therapeutic tracheostomy for a patient with acute upper airway obstruction. What CPT code should be reported? A. 31600. B. 31,601. C. 31,603. D. 31,605. Answer: A. 31,600. This question assesses the CPT coding for a tracheostomy performed in an emergency or therapeutic setting. The keyword therapeutic tracheostomy implies an urgent, non-planned procedure to establish an airway. CPT code 31600 describes a tracheostomy, planned, separate procedure, which is typically chosen for therapeutic situations without extensive preparation or other complex procedures. For example, if a patient suddenly cannot breathe due to an allergic reaction and a surgeon creates an opening in the trachea to insert a breathing tube, 31,600 would be appropriate. It's crucial to distinguish this from a tracheostomy performed with laryngectomy or other major head and neck surgeries. Question 16. A patient undergoes a bronchoscopy with transbronchial lung biopsy. What CPT code should be reported? A. 31,622. B. 31,625. C. 31,628. D. 31,629. Answer: B. 31,625. This question evaluates the CPT coding for specific interventional procedures performed during a bronchoscopy. The keywords bronchoscopy and transbronchial lung biopsy clearly point to a tissue sampling from within the lung through the bronchial tree. CPT code 31625 specifically describes a bronchoscopy with transbronchial lung biopsy, S. For example, if a physician uses a bronchoscope to visualize the airways and then passes a biopsy forceps through the scope to take a sample of lung tissue, 31,625 accurately captures this procedure. Each distinct diagnostic or therapeutic maneuver during bronchoscopy usually has its own CPT code. Question 17. A patient presents with a history of recurrent pneumothorax and undergoes a pleurodesis via thoracoscopy. What CPT code is appropriate? A. 32,551. B. 32,552. C. 32,650. D. 32,655. Answer: D. 32,655. This question tests the CPT coding for surgical intervention to prevent recurrent pneumothorax. The keywords pleurodesis and thoracoscopy are essential. Code 32655 specifically describes a thoracoscopy with pleurodesis, which is a procedure that creates adhesions between the two layers of the pleura to prevent air or fluid from accumulating. For example, if a surgeon uses a scope to visualize the chest cavity and then applies a sclerosing agent to fuse the lung lining to the chest wall, 32655 is the correct code. It's important to differentiate this from simple drainage procedures. Question 18. A patient is seen for recurrent epistaxis, nosebleed, and the physician performs cautery and packing of the anterior nasal septum. What CPT code should be reported? A. 30,901. B. 30,903. C. 30,905. D. 30,906. Answer: A. 30,901. This question assesses the CPT coding for control of epistaxis. The keywords epistaxis, cautery, and anterior nasal septum indicate a unilateral control of a nosebleed. CPT code 30901 specifically describes control of nasal hemorrhage, anterior, unilateral, by cautery or anterior packing. For example, if a physician uses a chemical or electrical cautery to stop a nosebleed on one side of the front part of the nose, 30901 is the appropriate code. Remember that posterior epistaxis or bilateral anterior procedures would use different codes. Question 19. A physician performs a rigid laryngoscopy with biopsy. What CPT code should be reported? A. 31505. B. 31525. C. 31535. D. 31536. Answer D. 31536. This question tests the CPT coding for laryngoscopy procedures. The keywords rigid laryngoscopy and with biopsy are crucial for selecting the correct code. CPT code 31536 specifically describes a laryngoscopy, direct, with operating microscope or telescope, with biopsy. While 31535 is for diagnostic direct laryngoscopy, the addition of a biopsy makes 31536 the appropriate choice, as it is a more comprehensive code for the procedure performed. For example, if a physician uses a rigid scope to visualize the larynx and takes a tissue sample, 31536 accurately reflects both the visualization and the biopsy. Question 20. What anatomical structure separates the thoracic cavity from the abdominal cavity? A. Pleura. B. Pericardium. C. Diaphragm. D. Mediastinum. Answer C. Diaphragm. This question tests fundamental anatomical knowledge related to the respiratory system. The keyword separates and the mention of thoracic cavity and abdominal cavity directly point to the diaphragm. The diaphragm is a dome-shaped muscle that plays a crucial role in breathing and physically divides the chest cavity from the abdominal cavity. For instance, when you take a deep breath, your diaphragm contracts and flattens, increasing the volume of your chest cavity. Understanding basic anatomy like this is essential for accurately interpreting medical documentation and selecting the correct codes. Question 21. A patient with chronic rhinitis undergoes turbinate reduction, unilateral, by ablation, using radiofrequency. What CPT code should be reported? A. 30130. B. 30140. C. 30801. D. 30802. Answer D. 30802. This question assesses the CPT coding for turbinate procedures, specifically reduction using a particular method. The keywords turbinate reduction, unilateral, and ablation, using radiofrequency, are key. CPT code 30802 specifically describes cautery and or ablation, turbinate, S, radiofrequency, unilateral. For example, if a physician uses a radiofrequency device to shrink the turbinates on one side of the nose to improve breathing, 30802 is the correct code. Remember to differentiate between different methods of turbinate reduction and whether they are unilateral or bilateral. Question 22. A patient undergoes removal of a benign polyp from the vocal cord via microlaryngoscopy. What CPT code is appropriate? A. 31540. B. 31541. C. 31570. D. 31571. Answer A. 31540. This question tests the CPT coding for laryngeal procedures, specifically polyp removal with a microscope. The keywords benign polyp, vocal cord, and microlaryngoscopy point to an excision under microscopic guidance. CPT code 31540 specifically describes laryngoscopy, direct, operative, with excision of tumor and/or stripping of vocal cords or epiglottis, with operating microscope or telescope. For instance, if a surgeon removes a small growth from a patient's vocal cord using a microscope for precision, 31540 accurately reflects this procedure. Be sure to select codes that specify the use of a microscope when documented. Question 23. A patient presents with difficulty breathing and a diagnosis of acute bronchitis. What ICD-10-CM code should be assigned? A. J29. B. J40. C. J41, 0. D. J42. Answer. A. J29. This question tests the application of ICD-10-CM codes for respiratory infections. The keyword acute bronchitis is the primary diagnosis. Code J29 specifically represents acute bronchitis, unspecified, meaning the causative organism is not documented. For example, if a patient has an acute cough and inflammation of the bronchial tubes, and the physician diagnoses it as acute bronchitis without specifying viral or bacterial, J29 is the appropriate code. Always use the most specific code available, but revert to unspecified when documentation lacks further detail. Question 24. A physician performs a thoracentesis with insertion of a needle to withdraw fluid from the pleural cavity. What CPT code is appropriate for this procedure? A. 32554. B. 32555. C. 32557. D. 32551. Answer. D. 32551. This question focuses on the CPT coding for a common diagnostic and therapeutic chest procedure. The keywords thoracentesis and insertion of a needle to withdraw fluid from the pleural cavity clearly describe the procedure. CPT code 32551 specifically describes a thoracentesis, puncture of pleural cavity for aspiration, initial. For example, if a physician inserts a needle into the chest wall to drain excess fluid around the lung, 32551 accurately reflects this service. Remember that imaging guidance, if performed, would be coded separately. Question 25. A patient undergoes an excision of a lesion of the skin of the nose, requiring an excision with complex repair. What CPT code range would typically be used for the excision of the lesion? A. 10,000 to 19,999. B. 20,000 to 29,999. C. 30,000 to 39,999. D. 40,000 to 49,999. Answer. A. 10,000 to 19,999. This question tests knowledge of the general CPT code ranges and body system organization, even though the nose is part of the respiratory system. The keywords excision of a lesion of the skin directs you to the integumentary system codes. CPT codes 10,000 to 19,999 are specifically dedicated to procedures performed on the integumentary system, including skin excisions. For example, if a dermatologist removes a mole from the bridge of the nose, the excision itself would be coded from this range, and the complex repair would also fall within the same section. Always remember that procedures are generally coded based on the body system where the primary intervention occurs, not just its anatomical location's typical system.